Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Modafinil, also known as Provigil. It's used for narcolepsy, it's used for sleep apnea, and it's used for work shift disorder. So what is it? It's to increase wakefulness. So if you have sleep apnea, you're constantly you're not getting good quality sleep, which means you're waking up, you're really groggy, you're tired, and it's kind of hard for you to get through the next day, depending on what work you have. Narcolepsy, obviously, you're falling asleep throughout the day. It's not your fault, it's just what is going on with your chemical in your body. Work shift disorder, same thing. If you recently just started working, overnights, it happens in the medical field a lot. We'll do 7 a.m. to 7 p.m. 7 p.m. to 7 a.m. shifts. Hard to stay awake. It's hard to stay awake. So what this does is by increasing the amount of dopamine in your brain. Now they say the mechanism is technically unclear, and you guys know how much I hate when literature tells us that the mechanism of action is unclear, because I don't like that. I like answers. They think it works by increasing dopamine in your brain, which helps in turn increase alpha waves. So when we're talking about sleep and stuff like that, alpha waves are the highest when we're awake. So we're trying to increase those alpha waves, which would in turn lead to us being more awake, being more alert, being more pretty much not able to sleep. So that's what this medication does. Now, a lot of people say, hey Tarun, how's it different than Adderall? Adderall doesn't necessarily, well, it is a stimulant, so it does keep you asleep, but it focuses you. It works differently than this, right? So if you have work shift disorder, you're not going to use Adderall. That's the wrong way to use that medication. You use this medication because of the way that it keeps you alert. So let's move on. Let's talk about pregnancy. So it is a pregnancy class C, which means you have to weigh out the benefits and risks with your doctor to see if this is something that is appropriate for you to take. It does come through in your breast milk, so that's again another thing that your doctor needs to check up on with you to see if it's appropriate. If you have renal issues, you generally don't mess with this medication in terms of its dosing, so you're not worried about it. Liver, yes, you do need to adjust this dosage if you do have liver issues, but again, your doctor should know everything, what's going on, and all the different medications you're at. Now, it peaks in about 2 to 4 hours, so it's very quick acting, right? So which means you'll see the maximum effect in 2 to 4 hours, depending on your body chemistry. Everyone's body's a little bit differently, so all medications work a little bit differently, right? Makes sense. Here's a list of side effects. The main things you're always going to be looking for is things like decreased appetite, headaches, abdominal pain, nausea, vomiting, rashes. If you get really bad rashes, you need to stop this medication immediately. Call your doctor. Now, generally, you take this in the morning, right? Because you want to increase wakefulness. You wouldn't take it anywhere near bedtime because it'll prevent you from going to sleep. So during the day, it keeps you up, so you want to take it then. For people with work shift disorder, you generally take this about an hour before your shift, and that kind of helps keep you awake, right? Now, off-label, this medication, I should have mentioned this a lot earlier, ADHD, attention deficit hyper disorder, fatigue related to cancer, and then major depressive disorder. So this can be used as a third or fourth line therapy to help with other medications to kind of help you with those other things. Those are the off-label uses, meaning it's not FDA approved, but doctors use it because we see an effect in the public, so it does help in therapies. Guys, I think that's it. I think that kind of covers everything. So if you have any questions, concerns, leave them down below. Hit subscribe, let us know how we're doing with this channel. We are trying to make the best, most educational videos we can without kind of going over your head about it. So again, thanks for tuning in to Meds Made Easy. We'll see you next time. Bye.